Good afternoon. Okay, let's see. Connection available. Good afternoon. This is Leah with Providence Women's Healthcare with another Tuesday Talks. Thank you for joining us. Today we'll be talking with Dr. Shelley Dunson Allen, and the topic is Stop Excessive Bleeding. And she'll also cover some other issues that women face. So if you know someone who can use this information, go ahead and tag them. And feel free to comment and share the video. And in the comments, if there is something that is personal that you don't wish to ask right away, just go ahead and send us a message or even give us a call. So without further ado, I'm going to turn the camera to Dr. Shelley Dunson Allen, and she is going to take it from here. So thanks for joining us.
Hello everyone out there looking at this video. I am Dr. Shelley Dunson Allen at Providence Women's Healthcare, and today's topic is actually going to be about uterine fibroids and excessive bleeding and some significant facts about uterine fibroids for women to be aware of. So uterine fibroids are benign growths on the uterus. They actually are overgrowths of the normal muscle tissue of the uterus. These are not cancerous growths. They are not going to cause any long-term significant health concerns in terms of life or death from a cancerous type problem. However, they can cause a lot of very difficult symptoms that can be really challenging for your quality of life on a day-to-day basis or monthly when you have your period. Interestingly, approximately 30% of African American women are known to have uterine fibroids and can become symptomatic from these. Overall, in all women, the rate of uterine fibroids is about 20%. The symptoms of fibroids typically can range, and the most common symptoms of uterine fibroids are heavy bleeding when you have your period or lots of cramping when you have your period. In addition, you may have increased frequency of urination because of the fibroids kind of pressing against the bladder. Some women experience constipation. Some women just have such a growth in their lower abdomen that they're unable to wear their normal clothes because the fibroids have distended their abdominal cavity. So all of these symptoms are very common symptoms that women tend to come in for. Normally, your period should come once a month. It should last for approximately 4 to 7 days. Usually the bleeding starts off light and then becomes heavy for a couple of days, meaning maybe 4 to 5 pads during those days, and then it usually tapers down to 2 or 3 pads or tampons for the remainder of the period. A lot of women who have uterine fibroids have heavy bleeding using 10, 12, 14 pads a day and or tampons, having lots of cramps, usually not necessarily relieved with Motrin or Aleve or some of those common over-the-counter medications. They can have a lot of blood clots to form, which of course reflect a lot of heavy active bleeding. And so these are usually the symptoms that women will come in with. Complications that can occur by having uterine fibroids depends on where you are in your stage of life. If you are not pregnant, then by having all of this heavy bleeding, you can actually become very anemic. And with a low blood count, it puts a lot of stress on your heart and your other structures in your body that need to have blood supply. So for a lot of women, they become very fatigued and exhausted all the time because they become severely anemic from the bleeding associated with their fibroids. In addition, if you're having a lot of pain and you end up taking a lot of medicine like Motrin or Aleve, it can really upset your stomach and you can develop some ulcerations in your stomach that can cause GI bleeding and those types of symptoms. So, some of the consequences of not having treated the fibroids or controlled the bleeding in some way can cause other problems that are more serious for your heart as well as for your stomach and your liver. If you take a lot of Tylenol, there can be a problem there. So we really do try to address the symptoms associated with fibroids. If you are pregnant, this can be a big problem because frequently if your pregnancy is trying to implant in the uterus where there are large fibroids, then frequently the baby cannot get a good sort of grounding into the uterus, so to speak, or implantation, and this can increase the risk of a miscarriage early in pregnancy. In addition, you can have preterm labor more commonly because the uterus, as it continues to grow and stretch, it kind of contracts back because of these large uterine fibroids. So preterm labor is another big concern for patients with uterine fibroids. The other issue for patients with uterine fibroids during pregnancy is that frequently if you have large fibroids and they're at the lower segment of the uterus, they can actually obstruct the baby from being able to pass through the birth canal because these large tumors are obstructing that process. So for these women, it can be a problem. One other major problem is that frequently, even if you don't have any of these other issues, because fibroids tend to grow during pregnancy, they're stimulated to grow by estrogen, which is produced by your ovaries, and all women have estrogen production. When you're pregnant, it becomes very, very significant estrogen production, and these fibroids can actually grow in pregnancy and cause a lot of pain. So because of these reasons, it may be recommended that you have the fibroids removed prior to a pregnancy. But that will be an evaluation. Each woman's different. It depends on the location of the fibroids, the size of the fibroids, and what the symptoms are prior to pregnancy. And we'll talk a little bit further about what types of things can happen subsequent to have a healthy outcome if in fact you do have uterine fibroids during pregnancy. How do you know whether your fibroids need to be treated or not? Well, you do need to be seen by your doctor. Probably your blood count may need to be checked. We'll need to find out historically from you what your symptoms are during your period, what kind of pain level you have, how much bleeding you're having, and then that'll help direct treatment. Treatment can be a number of things. If you are not pregnant, we can frequently treat fibroids with cycling you on birth control pills or something called NuvaRing, which is another method of sort of cycling your periods. It usually thins the lining of the uterus. It decreases the amount of bleeding that women have when they have their period. So being on birth control pills or using NuvaRing can be the first approach to trying to address uterine fibroids. After that, we also do recommend for some women something called a Mirena IUD because this device actually thins the lining of the uterus and it decreases the amount of bleeding that women have when they have their period over time. So this is also another excellent opportunity for women who have uterine fibroids to be treated in a fairly easy method. It's something that can be provided in the office, and the Mirena IUD is actually recommended for women who need contraception and have heavy bleeding with their fibroids. The Mirena IUD can last for up to 5 years, so a lot of women get significant relief during that time. And then if they like the Mirena and they did well, then frequently you can just replace that Mirena IUD every 5 years, and for a lot of women, it's a great solution. After that, then there's an opportunity to have a procedure done by the interventional radiologist, who is a physician at the hospital, who is frequently able to evaluate you and do a couple of additional sort of radiographic studies like an MRI to assess to see if you may be a candidate for a procedure called a uterine fibroid embolization procedure. This procedure is actually done by the radiologist, and it is done through a sort of catheterization approach where they go in and place a little catheter through usually your vessels in your groin and are able to kind of get it up to where the fibroids are and basically put some particles up there that obstruct the blood supply to the fibroids, so they effectively are embolized, lose their blood supply, and then they shrink down and frequently don't cause the symptoms of bleeding. This works about 80% of the time, and in patients who are candidates. And again, you'd have to be evaluated, have a consultation, and likely an MRI to see if you are a candidate or not, because the fibroids can be in different locations in the uterus. And sometimes this procedure is helpful if the fibroids are in a location that is approachable this way. So that would be another option for treatment. The next thing that would be an option for treatment is a shot of medicine called Lupron, and that medication can be given for up to 6 months. And for women who are close to menopause or who are so anemic they can't go to surgery because of this anemia, it can temporarily stop your periods for about 6 months, and then this will give an opportunity for your blood count to recover. Or if you're very, very close to menopause, perhaps by the time the treatment is completed, you'll be menopausal, and therefore no more estrogen, no more bleeding, and no more difficulty with your uterine fibroids. So this is an option, but again, it really only works in those two circumstances because the time that you can do this medication is only for 6 months. And then if you don't have further treatment, frequently your symptoms are back and you're having heavy bleeding and pain again a few months later. And finally, the other options for treatment of uterine fibroids are surgical options. And those surgical options are done by the gynecologist, like myself. And this would be either a procedure called a myomectomy, which is where we just remove the uterine fibroids from the uterus and try to preserve the uterus for women who desire future fertility. They want to have a baby in the future. So for those women, a myomectomy is a great choice because it actually removes the tumors, and then periods resume being normal, and you still have the opportunity to have a pregnancy in the future, usually with a myomectomy. It is usually an open procedure where we have to do a larger incision because we actually bring the uterus up and cut out all the fibroids, sew it all up, and put it back inside the abdominal cavity. And after a few months, to allow healing, women are able to try to begin to conceive. And this usually works out really, really well. It does give the option for women to have a successful pregnancy in the future. Now, the caveat is once we've made incisions on your uterus, you really have to have a C-section for your delivery. And the reason why is because the uterus, once you've had incisions on the uterine wall, it weakens the wall of the uterus. The uterus still can carry a pregnancy to term with no problems whatsoever. But during the course of labor, because it's hours of high pressure in the uterus, as that uterus contracts and thins out, there's a big chance that the uterus could actually tear during labor over time, during the labor process. So we don't allow women who've had a myomectomy to labor because of the risk of uterine rupture. And if that occurs, it is a catastrophic event for the mom. Mom could bleed to death, potentially not survive it, and the same thing for the baby. So we really do not allow women to have a vaginal delivery if they've had a previous myomectomy, and they really have to be scheduled for a C-section. Now, the good news is, here at Providence, we do offer family-centered cesareans as an option for women who are going to have a scheduled C-section and maybe not be a candidate for a vaginal delivery. And a family-centered cesarean is basically an opportunity to have a scheduled C-section. We have arranged for the nursery staffing to be available to allow that baby and that family, mom and dad, and potentially another birth assistant to be present in the operating room. We are able to immediately have mom to be able to see the baby. After a very brief evaluation by the pediatric staff who's present, we usually try to bring the baby over immediately so that the mom can have an opportunity to have skin-to-skin contact early with the baby and stay with the baby during the course of the remainder of her cesarean delivery. After the delivery, the mom, the dad, the baby all go to the recovery room together as long as the baby's stable and doing well. And then the baby is evaluated there in the recovery room with the mom right there and the dad present. So for a lot of patients, it's really a much better experience because it does allow you to continue your initial bonding immediately after delivery. Then after your recovery is done and mom is stable and has been observed for 30 minutes to an hour, the mom, the baby, and the dad or their birth assistant all go to their postpartum room together. And at our hospitals, we do have patients and moms and babies to room in usually. So the baby stays with the parents during the course of their postpartum time. And for a lot of women, even though they have to have a scheduled C-section, they're very happy because they're still able to have a wonderful birth experience. So that sort of was a digression related to sort of how fibroids work in pregnancy. For women who are not interested in pregnancy in the future and they're having a lot of symptoms, and for whatever reason the other options are not good options for them, or they want to have what we call a definitive procedure, they want this to no longer be a problem for them ever, then they may be a candidate for a hysterectomy, which is basically to remove the uterus where the fibroids reside so that there's never a problem with this woman having recurrence of new fibroids or continuing to have bleeding and pain. The good news is for women who are having a hysterectomy, we frequently can do it laparoscopically, which is a minimally invasive approach. If the uterus is not extremely large, then frequently we can put small little incisions on the abdominal wall where we can put a telescope in or a laparoscope, and then 2 additional little ports to be able to work from. And so effectively you can kind of think about it. We can disconnect everything from above. We actually bring that uterus out through the vagina, and then we're able to go up and close that cuff where the uterus was, the cervix was. It maintains the vagina. Women have great sexual function after a hysterectomy. You have an option at the time of the hysterectomy, depending on how old you are and what your ovarian function is, to either have your ovaries removed prophylactically at that time or not. And you can continue to have the benefit of your ovarian function. Now, the good news is for women who have a hysterectomy, you will never have another period. There's no place for fibroids to come back. And so most women become asymptomatic with their uterine fibroids. They don't have bleeding, no issues with anemia going forward, and no further periods, and of course no fertility as well because there is no uterus. So for a lot of women, it's a great sort of final solution to the problem. For women who do have a myomectomy, the only problem is sometimes if you're very young, there can be a problem with fibroids, not the ones that have been removed coming back, but new fibroids growing. And in another 5 to 7 years, you may end up having to have surgery again for a problem with new fibroids that have grown and caused the same symptoms. However, if childbearing is definitely on your agenda, you usually have had an opportunity to have your family in the interim. And so it usually works out fine, so that if in fact it is a problem in the future and you've completed childbearing and unfortunately you do need to have surgery or you elect to have surgery again, then there may be a final procedure with a hysterectomy at that time. So that's sort of a summary of uterine fibroids related to women who are pregnant, women who are not pregnant. We don't know why people have uterine fibroids. There's always that question like, where did this come from? And of course, we really don't know exactly why they happen. However, the good news is we have several ways that we can treat them, and it really is an individualized approach based on your symptoms, what you would prefer, medical management, outpatient fibroid embolization, or surgical management. And with a consultation with your doctor, we can help you decide what it is that you would be most comfortable with and hopefully have a good quality of life if we're able to control the symptoms of uterine fibroids. So I'm going to kind of stop there. I think it's about 15 minutes, and I think people may have some questions.
Yeah, if you have any questions, go ahead and ask. Just type it in the comment section. If it's a personal question for you and you don't really want to type it in the comment section, go ahead and send us a message. That will work. But I have a couple of questions.
Okay.
But this was so packed with information. You were so thorough. Like every question I had, you answered it right as I was writing it down. So that was awesome.
I've done this a couple times.
Yeah. Okay.
And this is typically what I talk to patients about, because typically these are the questions that people really want to know when they're trying to decide what this is, why did it happen to me, and what are we going to do about it. Right,
exactly. So I'm still here, you guys. You're just going to hear my voice, but I want the camera to be on Dr. Dunson Allen. So up until, say I'm having these symptoms and I can't make my appointment yet. Say I have insurance coming, I have an insurance issue. What can I do as relief until I'm able to make an appointment?
Right. So unfortunately, most of the things we talked about are all things that require an evaluation and a prescription.
Okay.
But certainly over-the-counter things like Motrin Aleve can be helpful with the symptoms if you're having a lot of cramping, a lot of pain. It can also decrease the amount of bleeding, but you do want to limit it to the time of right around the period and not take it throughout the course of the month if at all possible. So those types of things are things you can do. Also, if you're bleeding heavily, you probably need to be on iron. So you can get that over the counter as well.
Yeah, that
and
makes
you can
sense.
take a daily iron supplement because you can assume that if you're bleeding that heavily, you are going to be anemic.
Yeah. Yeah, that's pretty good. So how would, so the anemia question, the reason I'm asking because my daughter, you've actually seen her regarding this here.
Right.
Yeah, and so she just throughout a regular cycle, not a period cycle, I mean a regular cycle, just living cycle,
Right.
experiences, fatigue, she's tired. Is that because of the fibroids, or is that?
That's a different story.
Okay.
We're talking about, I spoke specifically about uterine fibroids and how this impacts bleeding. So women sometimes also have heavy bleeding, doesn't have anything to do with fibroids. They just have heavy bleeding with their periods. So in young girls, that's very common. As they begin their period, they typically can have a lot of heavy bleeding. Some girls bleed for months, and it's really bad because they're young, they're active, they're involved in sports, and it's very debilitating for their life. They're fatigued, they can't go to school, and that kind of thing. So we use similar medical management for those patients, and they are not sexually active or anything like that, so obviously NuvaRing would not be a choice. But certainly birth control pills are awesome because they can regulate girls' cycles. And a lot of times there's an opportunity to really do continuous birth control pills so that the girls really have a period like every 3 or 4 months, which really works out really well for a lot of young women who have problems with heavy bleeding with their periods.
Yeah, that's good to know.
Mm-hmm.
Okay, so all my other questions you answered, like right off the cuff. And when you mentioned the hysterectomy and I wanted to know what some of the side effects were. Mainly, I was thinking about how does that work with your sexual life, and you said that it doesn't affect.
Right. So really your sexual response is from 2 major places. It's going to be the G-spot on the posterior wall of the vagina, which is still definitely intact, and the clitoris, really. Those are the primary, really, sexual response organs. Okay. Now, a lot of people think that their cervix is important, and scientifically, it really is not, okay? However, some women do feel that they would like to preserve their cervix, which is the opening to the uterus. So that is an option. If you would like to preserve your cervix and have that present because you just want your cervix to still be there, you do need to have a pap smear on, as regularly scheduled. And sometimes if we do what we call a supracervical hysterectomy and leave the ovaries in, there's still some little tiny glands there that can bleed every month. So now you've had surgery, you've had hysterectomy, but you're still having a period every month. So that's kind of a little dissatisfying.
Yes, we would agree.
So for a lot of women, we usually will recommend that the cervix just comes out with the uterus. But if a person feels very strongly they want their cervix to stay, and it's normal, then that's definitely an option.
Okay. Wow, this was so much good information. Do we have any questions here?
No, I don't see any.
No questions.
No questions.
Awesome.
The women don't have any questions about fibroids? That's amazing.
No, that's because I tell you, when I wrote down the questions that I had, you answered them. So that's because you were so thorough.
Oh, that's great, and that's helpful. And a couple of other things. I did speak specifically about fibroids. When we introduced the talk, it was about excessive bleeding, and I did want to just comment. We do have our teenagers who have heavy bleeding. We have women who have heavy bleeding, and it doesn't have anything to do with fibroid. It's just every month they have heavy bleeding. The birth control pills, frequently we're able to use for that. Then there's another procedure that I did not actually comment on, but it's very, very good. So when we rule out everything else as a reason for why you're having this, but you have completed your childbearing, and you are just having a heavy period every month, and you're really not going to ever get pregnant. The good news is there is an office procedure that we can do. It's called an endometrial ablation, okay? And what that does is basically we cauterize the lining of the uterus that bleeds every month. And so that procedure is effective about 60% of the time. Women really have no more periods ever. About 30% of the time, they have a very light period every month. 10% of the time it does fail, but 90% of the time women get significant relief. Now, it does cauterize the lining of the uterus, so this is not for women who choose to have future babies, because the pregnancy needs to implant in the lining of the uterus and it needs to be normal. And so if you want to be pregnant in the future, this will be not the procedure for you. But for a woman who's done having babies, she don't have fibroids, she doesn't have anything else, but every month she's just having heavy bleeding. Maybe she had her tubes tied, so she really doesn't need contraception. She don't want to be on birth control pills. Maybe she's hypertensive. Maybe she's had a history of breast cancer. She does not want to be on pills or hormones, but she wants to not bleed to death every month. Endometrial ablation is a great option.
That's great.
That was actually the question.
Oh.
Yeah, that was the question. Yeah. That was awesome. Wow, this was some good information. Ladies, on Women's Month, this was awesome. So, again, if you have more questions that you want to ask, go ahead and send us a message and we'll get those questions answered. And we thank you for joining us. What's that? For another Tuesday's Talks. Yeah, visit our websites at pwhcares.com or providencemidwifery.com and sign up for our newsletter from both of those websites as well. So thank you again. We look forward to having another Tuesday Talk with you and having you join us. Go ahead and share this video, tag a friend, and keep the conversation going. This was good stuff. All right, have a good afternoon.